And I'm so delighted to be seated next to a very great team that are doing a very good job in this county, specifically Lawrence County Health Department. And my name is Jacob Otile. I'm from Indiana University School of Public Health. And I wanted just to sit with you and have a discussion of to let the public get to know what you do. I mean, many people are there always asking themselves, what do health departments actually do? And they don't really know much. And I think it's important for us to paint the picture for them to understand that. And I think today's conversation is going to help us understand what goes on in our health departments that the public doesn't really know about. And also, most importantly, National Public Health Week is upcoming in April. And in celebration of the National Public Health Week, I think it's important that we have this conversation. So with me, I have the great team from left to right. I want to request you to just introduce yourself, which department specifically that you work at Lawrence County Health Department, and let's have a conversation. I'll start with the gentleman.
Good to be here, Jacob. I'm Mitchel Knapp. I'm with the Lawrence County Health Department Nursing Division, and one of my primary roles is health promotions, but I'll talk a little bit about what the nursing division side of the health department does today.
Good to meet you, Mitchel.
Hi, I'm Priscilla Terrell. I'm Environmental Food Protection Specialist with the Lawrence County Health Department. I oversee the pools, food, and tattoo.
When you talk about food, you excite me.
So,
yeah.
It can be exciting.
Mm-hmm. But also it can be not so exciting at the same time. That's why we have you there, right?
Yes.
Okay, and
my name is Paula Kern-Edwards. I'm the Vital Records Registrar for Lawrence County. So in small counties like ours, Vital Records also pulls in a lot of other duties as well. But my main is being the Vital Records Registrar.
Good to meet you all. I think I'll start from Paula. If you wouldn't mind just sharing, what does your day-to-day activity at the health department look like?
Sure, it kind of depends on the day. Like today, I had to have payroll in by 10 o'clock. Didn't get there at 10. I was working by myself today, so it got a little off. But you also check the state's website to see if any deaths have been put on for you to register. You also check your email to make certain that if funeral homes have sent you any requests for death certificates as well as updates from the state. You're there answering the phones and disseminating those phone calls to the rest of the department, the other divisions. And you're also, with the traffic that comes in off the street, you're issuing birth and death, and a lot of phone calls asking, how do I get a birth certificate? What's the cost? What do I need to bring? I don't have any ID. What do I do? There's a lot of different questions. One of the exciting new developments that we've had is that as of last week, we're able to issue for any county in the state, whether it's a death certificate or a birth certificate. Before, you had to have taken your first breath or your last breath in a county in order to get either of those certificates. And with Lawrence County having lost their birthing hospital, that's actually a plus for us. Residents of Lawrence County won't have to drive to Monroe to get their child's birth certificate when they're going into sports or starting to drive a car or any of the myriad of things, insurance, that they need them for.
Awesome. It looks like you have a lot going on whenever
we
you're
have a
at
lot
work.
of fun.
That sounds like a lot of fun if I'm to reiterate what you just say.
Every day we leave and we say, hey, we get to come back and do it again tomorrow, and we really try to mean it.
Okay. That's awesome. Priscilla.
Yes.
How about you? What does that area that we talked about, environment and food, how does that look like on a daily basis? Because I know we talked about food being something that excites everybody. People love their food because it's what gives us the energy. Yeah. But also there is the other side of it. But in general, Could you just paint a picture for us how that looks like?
Depending on the time of year, like right now, my temporary events are starting to pick up. So they'll come in, different food vendors will come in, and they'll apply for temporary permits to set up and sell food, whether it be a backroads market, the Women's Expo, just any event that temporary food vendors will be at. They'll apply 3 business days prior to the event to get that permit and that application and that payment to us. I'll go out and do inspections on them, and then I also have to put in my routine inspections for retail food establishments. The tattoo establishments, they get inspected routinely. My semi-public and public pools, they get inspected routinely. So basically, 1 or 2 inspections a day, answering my phone calls, my emails, emailing applications, whether it be food, pool, or tattoo. We do a lot of that by email.
Why is silent mode not silent?
Say that's not mine. And
Yeah, just you were telling us about the temporary permits and how the process goes.
Yep.
Like, yeah.
and our annual retail food establishments and our annual mobile permits, they renew every year, January 31st. We give them a courtesy grace period till the January 31st. They're actually due December 31st yearly. And with tattoo establishments, being that fee is a little hefty, we give them until March 31st for those to be renewed, and with pools as well.
Okay.
Yep. And they have to renew all, like the seasonal pools, they only they renew, they're just 6 months, but they still have to be renewed at the same time.
Okay. Okay. And in general, what is the essence of having these permits? So for somebody out there who doesn't really know what the permits you're talking about.
Well, when you're referring to food, we want to know who's coming in, selling what, doing what, because there's things that have to be implemented when you do food. You have to have hand washing sink. You got to be able to wash. You've got to follow these steps to be in compliance with the rule.
So in other words, you're sort of making sure they stick to the regulations so that food does not get contaminated.
Yes. Yes.
But there have been instances where people have got food poisoning, for example, at events and stuff like that. How does that process go? Like, I know that's your area that you usually handle. What's the reporting process and how does it get to you? How do you follow up and all
So
those things?
I like to, I have an event organizer form that I've put in place.
Okay.
The state passed it down. They kind of put it in my hands for me to use. That's made my job a lot easier. So I reach out. Usually I find things on social media. People tell me there's an event coming up. So I'll reach out to the event coordinator and get that application into their hands, that form. And that's my point of contact. So it has all the food vendors, kind of what kind of food they'll be selling. And then that alleviates the middle person. And then I can make direct contact. And then we can get everything squared away before the day of the event.
Okay. Well, again, these are the things that the health department are able to do, especially today we're talking about Lawrence County Health Department, and I'm sure there are very many people who didn't actually know that for you to be able to get food at an event, there's been background processes that have gone on before the food can be there. It's not just me waking up and saying, oh, let me have food at an event and so on and so forth. So thanks for sharing that. Yep. Mitchel, the nursing department, what does that look like on either a daily basis, a weekly basis? Could you just paint that picture for us?
Yeah. So the nursing division at the health department, we do many things, but I'll talk about some of our daily public-facing tasks that we handle. People will come in either for immunizations, either receiving immunizations or just getting records of what immunizations they've had. as well as skin TB tests. So that's a skin tuberculosis test.
Yeah.
So we provide both of those services to the general population, and we can assist people that both have and do not have insurance.
Okay.
For speaking specifically for immunization services.
Okay.
So when somebody calls in and says, "Hey, I've got a kid going into kindergarten and they need their vaccinations," we're able to have that conversation with them. It's like, okay, for your age, here are the recommended vaccines. Here's the schedule that we can provide for you to come in and get those. It might take more than one visit. We'd schedule those out for them.
Yeah.
And as stated, peoples that have insurance, we'll run this through insurance. For peoples that do not have insurance,
Yeah.
I mean, that's only $15 cash and appointment to show up. So
Okay.
for that full service, $15 cash.
Okay.
And peoples that, a lot of those going to school or medical field require that skin tuberculosis test, the skin PPD test,
Yeah.
to see if you've had past exposure to tuberculosis.
Yeah.
We provide that test as well. It's a two-step test.
Okay.
You'll have the initial placement where they'll do an injection on your forearm. There'll be a little bubble. It'll disappear.
Yeah.
And you'll come back 48 to 72 hours later and do an interpretation of that test.
Okay.
The nurses there will help you with that. And that's one of those mandatory things that for
Yeah.
different schools are coming and going from different locations you have to do.
Yeah.
And that's $25 cash. It is important to say there are some of our services that are cash only.
Yeah.
And scheduling does help.
Okay.
If you want to call in to schedule something, I mean, we can accommodate that.
Yeah.
You can call in the office. Its general line is 812-275-3234. And the nursing division specifically is extension 2613
Okay.
to schedule anything, but that's not to say that we won't help somebody that walks in and just
Okay.
needs some help with something.
Okay. Well, you talked about two things that really caught my attention was the immunization aspect and the TB testing. But I wanted to, if you could shed more light on the immunization process, the scheduling process, the type of vaccines that normally the children normally get, and any other types of vaccines that maybe the health department can be able to provide, not only for children but other population as well. Is that something you'd want to share more on?
Yeah, I can share a little bit more about how the process for receiving an immunization at the health department works. So if somebody calls in, I mean, we'll ask that person whether it's for them or for one of their children or dependents. We'll ask for their name and date of birth. We'll look that person up in the Children and Hoosiers Immunization Record Program, CHIRP.
Yeah.
That's the state database that has all of the documentation
Yeah.
for immunizations. That started around 2002.
Okay.
So it was required that children, their immunizations are put into that platform.
Okay.
So some adults have immunizations in there as well that we can look at. There's been a good effort to make sure that's an accurate database.
Okay.
But children born after 2002, then their stuff should definitely be in there if they were born and received it in Indiana.
Yeah.
We'll look at the immunizations they've had, and especially for school-age children, there's a series of vaccinations that you'll receive at different ages, typically on entry to a grade such as kindergarten or 6th grade or 12th grade.
Okay.
And we will verify against that immunization record what immunizations they're due for. For example, going into senior year, typically you're going to get a meningitis shot.
Okay.
Peoples that are looking to go to college after high school, we'll talk about getting a meningitis B
Yeah.
vaccination.
Yeah.
So those services get rapidly tailored to whatever the age and demographic there are.
Okay.
We can provide for children specifically, or part of the Vaccine for Children program that the state of Indiana puts on,
Yeah.
where we're provided an inventory of vaccines for peoples that do not have insurance.
Okay.
And that's how we're able to provide those for $15 cash
Okay.
for the whole appointment. And all of your required immunizations are going to be in that inventory, and
Okay.
we'll be able to provide those. And we carry almost the exact same for our private inventory that is for people's with insurance.
Okay.
With exception for adults that don't have insurance, well, we just won't be able to provide shingles or RSV.
Okay.
So the respiratory syncytial virus, we don't have that one, unfortunately, for
Okay.
adults that don't have insurance.
Okay.
But all your other recommended vaccines, we typically keep on hand.
Yeah. Okay. How about on the side of the TB testing? What does the process look like through the scheduling process and until someone gets the testing and then the follow-up and all of those? How does it look like?
Yeah. So somebody whose employer or school might require them to have a skin purified protein derivative test, the skin PPD test
Yeah.
for tuberculosis. They can call in and we'll find an appointment that works for them. Typically, we'll place the initial injection on a Monday or Wednesday. You'll come in, it'll be $25 cash. This will cover both appointments, the first and the read.
Okay.
They'll come in, the nurse will do the injection placement on the forearm. There'll be a little bubble. It'll disappear typically after about 20 minutes. And then you'll go home. They'll advise you not to scrub it real hard when you're
Okay.
bathing or anything that might aggravate it.
Yeah.
And you'll come back scheduled 48 to 72 hours later. So depending on what day that it was initially placed, that's why we try to do them early on in the week.
Yeah.
That way you can come in on a Wednesday, Thursday, or Friday to receive that read. You'll come in, the nurse will see you, and then they'll just measure how large that reaction was on that space.
Yeah.
Once that's been done, they'll do some documentation, certify that result for you, and give you a copy of it to provide your school or your employer.
Yeah.
And if you ever lose that, we do retain records.
Okay.
There might be some additional steps to get those for you, but they do not typically go into a database. So
Okay.
you would have to call in the
And
office.
retrieve the records.
Yeah.
Okay. Just finally on that aspect, I know there is a lot of misconceptions, especially about vaccines in the public, whether it's ill-informed, whether it's well-informed. I just wanted, if you could just paint a little picture on just some of the things that the public should know about the importance of vaccination for both the children and for people at risk of certain diseases. I mean, if you could share that a little bit more.
Yes. So the reasons why immunization is important are to protect the individual receiving the immunization,
Yeah.
as well as to protect the general population at large.
Yeah.
There are peoples, because of medical conditions or they're not old enough to be able to be provided with an immunization that they can't receive yet,
Yeah.
so they can't receive that
Yeah.
protection with an immunization.
Yeah.
So it's important to surround them with people that are protected from acquiring that disease,
Yeah.
whether it be such as like measles currently happening.
Yeah.
And it's called herd immunity.
Yeah.
So the more peoples that are immunized or
Yeah.
have been exposed,
Yeah.
the more difficult it is for a disease to spread through a community.
Yeah.
So it's important to get your immunizations, such as flu,
Yeah.
to really stop that spread of disease in the community and help protect the people that are not able
Yeah.
to receive that protection themselves.
Yeah. Yeah, I think you bring up a very, very important aspect of herd immunity. It's having a bigger population getting immunized to protect like the smaller aspect of the population that ideally cannot or may not be able to get vaccinated and get immunized for certain diseases. So I think this is why the National Public Health Week is there, to shine light on some of these critical areas of letting the public not only know about the health department, but also know about the services such as immunization that goes on. And I think going forward, we should focus on letting the public aware of some of these services much more than the work we do only in the background, right?
Yes.
Because we can do all the work in the background, but then the public doesn't get to know about it. It feels like we are really not doing much. So I appreciate you sharing that. As we go towards the end of the conversation, I wanted to come back to Priscilla. You mentioned the processes of either obtaining a permit or getting them approved and all of these checks and balances. What are some of the challenges that you mainly encounter on a daily basis? And then also on the other side of it, how best can the public utilize the services that you do in the Environment and Food Department at Lawrence County Health Department?
So my biggest challenge is home-based vendors. That's where they can follow the House Enrolled Act 1149 and do food items that are not potentially hazardous, time and temperature controlled for safety, out of their home.
Okay.
You have to have an egg board license in Indiana to sell eggs off the farm. Once those eggs leave the farm, they have to be held at 41 degrees or below. They have to be labeled correctly, and you have to obtain an egg board license from the state of Indiana.
Okay.
A home-based vendor cannot just sell eggs without that egg board license.
Okay.
Now, if you sell any other egg besides chicken eggs, then you would come through the local health department and we would permit you. You would, send pictures and things of where you're going to store your eggs.
Yeah.
But the home-based vendor that's the biggest challenge. They think we have cottage law in Indiana. We do not observe the cottage law in Indiana. It's the House Enrolled Act.
Okay.
And in order to be a home-based vendor, you have to have a food handler certification.
Okay.
That is in that rule, that House Enrolled Act 1149. A lot of the home-based vendors do not have that. So therefore, that is a big hurdle.
Okay.
But I feel like, on the other hand, by them reaching out to me, getting a hold of me, whether it be through email, phone call, I can send all this in black and white right to them. I can get it into their hands immediately.
Okay.
So I feel like what I've obtained from the state, my other local health departments, guidance documents that the state give us, any kind of educational forms and materials that I can get my hands on, I get that right out to the home-based vendors.
Okay. Okay. Home-based vendors.
Yes.
It sounds like you're being called out a little bit, but I mean, it's very important.
It is.
It's as serious as it gets because food contamination can start from one person,
Yes.
and then a very big chunk of the population
And
is
the thing
affected.
with them, I don't know if they realize, but they can be held accountable just like a retail food establishment can. If there's an outbreak, someone gets sick and dies, they can be held accountable just like the next person.
Okay.
And you have to have it labeled correctly so we can trace that in case there was a foodborne illness outbreak.
Yeah.
That's why labeling is part of that House Enrolled Act 1149 rule.
Yeah.
So we can go back if there's an investigation that needs to be done and we
Okay.
can figure out where it started.
Yeah.
Yeah.
As you were talking, it reminded me of the story of Typhoid Mary,
Oh,
right? Mm-hmm. That's the story that I can think about at the moment as you were sharing. It starts from one person and spreads out.
Yep.
Just one person getting the food contaminated, and then the population all get exposed as long as you've come in contact.
and
that
with a
food.
home-based vendor, we don't inspect them routinely. The state doesn't go in and inspect them.
Yeah.
So we don't know. They could have dogs, cats running. You don't know what
Yeah.
somebody's home
Yeah.
is like.
Okay.
Yes.
So the home-based vendors can seek more information, and
Yes, absolutely.
they will be able to find that information through you
Yes.
easily.
Yep.
Well, thank you for sharing that.
You're welcome.
And Paula, as you were sharing about the Federal Records Department, what do you think the public still doesn't really know about your day-to-day activity, and what do you think they struggle a lot with in getting the services that you offer, and if there is anything they can do better to sort of make work both sides easy for the public and also for you? How do you think that looks like?
Well, I think there is a tendency to think a birth certificate is just a piece of paper rather than the very beginning of their identity.
Wow.
Because we will get a phone call I had this morning was, I've lost everything. I don't want to bother my parents to help me get it. So just get me my birth certificate, you know.
Okay.
And unfortunately, I finally had to break it down that what they were telling me they were willing to use wouldn't get them a library card, let alone the beginning of their identity. They couldn't check out a book with what they were telling me they had. We're willing to sit and go through documents and help them figure out, you know, whether a mother, father, sister, brother, a grandparent can help them get it and how to get it. But most people think it's just a piece of paper that doesn't have a lot of meaning. Unfortunately, it does. Or maybe fortunately, it does. And it needs to be a little bit protected.
Yeah.
In the same way we do maybe 20 home births a year.
Okay.
When an Amish family or a non-Amish family, but mainly it's Amish families that come in,
Yeah.
they have to have the baby with them. We have to see the baby. That's their proof of having had a baby, as well as many other documents and other pieces of paper. And then you only have 1 year to file that paperwork in the local health department, or it becomes what's called a delayed registration of birth. And there are still older people with delayed registrations of birth where you can only get it from the state. Now, if you're an Amish family, that would become a heavy burden to try and get, because there's no walk-in hours at the state. It's all write-in or it's on computer. The other is that we have records that begin in 1882 and go to current day, but probably the first 30 years that we were recording, they're only recorded in the local health department. You cannot go to the state to get them, so you have to go to your county, the county of the birth, to get them. But if there are any changes that need to be made to these records, and we can do low-level correction affidavits to change the spelling of a first name or a letter in or day of birth. Sometimes the day of birth has been recorded incorrectly. We can change that up until the time of that person's death. You can't come in to do genealogy later on and want to make a change to a record, because many people just choose not to fix their records. We tell them it's incorrect. They know it's incorrect. They're like, I'll just live with it. I don't want to spend $20 to change my record. And then the family is left with that. How do we make that progression from mom or dad or grandparent to settle the real estate or whatever when things are not spelled correctly? So I just urge people to take a look at their record, find out what's there, what's on the souvenir. Isn't necessarily what was legally registered with the state. Somebody with a pretty handwriting did the souvenir. Somebody was sitting or hand typing or writing it out. And I've seen even last names be completely different from one to the other. So with Congress, when the Twin Towers went down and Congress passed the Real ID Act, which people are still trying to get the stars on their driver's license for that, it said everything goes back to what's held at the state level. Before that, people could come in and there might be a mark out in a book. Your official records at the state, but there might be a mark out in the book, and we would continue to issue that. Once that went through, now we have to check and see what's at the state, and it has to only be issued with what the state holds. So there are a lot of people out there that come in their 60s and 70s and are surprised because they're trying to get the insurance for, sometimes even for mom and dad to go into a nursing home, or they're needing insurance because of an illness and they can't get it quickly because they're having to fix a name mistake. So I would just like people to realize that their birth certificate is a highly important document. Don't carry it with you all the time. People can have a tendency to carry their Social Security card, their driver's license, and their birth certificate. I call that an identity theft starter kit.
Okay.
Because you've got everything there to take somebody's identity away. And if you
Yeah.
have a Social Security card that's unsigned, sign it. You drop that in the street, somebody picks it up, signs your name in their handwriting. They can reproduce that handwriting all day long.
Yeah.
Sign yours. I see so many of them come in and signed anyway.
Yeah.
It's an important document. That would be my take on that.
Thank you. I mean, it's very important actually that you highlighted how important these steps are, because as little as birth certificate, little quote unquote, as some people might treat it, it's the beginning of your identity. And now you've lived 40, 50, 70 years of your life with a different identity, and now you've gone, your family or descendants have to face the consequences of the different identity you lived, because you couldn't spend $20 to correct it or an hour to go to the department and try and correct that. So I think that's very, very important for the public to know that, yes, as little as it looks or as small as it looks, it's important to have what is there correctly spelled, your identity correctly outlined, and then so that you avoid the consequences that can come in the future.
And don't call me from the dock when you're getting on the cruise and you forgot to take your birth certificate. I can't do anything, and I've taken that call many a time.
Okay, only call you when they're not on the cruise. Okay.
Yeah, do it way before.
Okay, good. If I wanted us to summarize this, any parting shots that you would love to share, just maybe in a minute or two before I can move to Priscilla?
Just that it's really a rewarding job when you can help somebody get their birth certificate,
Yeah.
and they have been struggling. It just kind of makes it all come together for you.
Okay. And Priscilla, any parting shots or thoughts that you would want to share to the community of Lawrence County?
I work for them.
Okay.
I'm available. I'm a phone call away, an email away, text away. Don't hesitate to call and reach out, because that's what I'm here for, is to help them.
That's why they pay you to be there, right?
I work for the public, yep.
That's very important. Thank you. And Mitchell, any other parting shots or some of the things that you wanted to share that we didn't get to go into?
Yeah, no, our nurses and staff at the nursing division of the health department love working with the population, and if you ever have any questions about what immunizations you might need or what immunizations you might have had, always feel free to call or stop through, and we'll do our best to help you.
Awesome. So it's for me, it sounds, it looks to me the whole health department is available and easily reachable, but the public don't utilize the services that they pay you to do. Isn't that ironic, right? Because the services are there, you are there to do the work for them, but we still struggle to utilize the services. So I think as we summarize this, I want to say thank you, Lawrence County Health Department and the team, Mitchell, Priscilla, Paula, and the rest of the health department, looking to the National Public Health Week, which is celebrated yearly by the American Public Health Association. I think this is an important conversation that I thought we would have to paint just a glimpse of what goes on in the health department. I know we have not talked about all the departments. We've just picked 3 of the departments that are available, but there is lots that go on in the department that in the near future we hope to have a similar conversation. And my name is Jacob Otile from Indiana University School of Public Health, and I've been hosting Mitchell, Priscilla, and Paula. Thank you very much for joining me.
Thank you for
Thank
having
you,
us.
Jacob.